right here. Today I want to talk to you a little bit about one of the most common injuries we see with our tennis players, and that is a ankle sprain. And here's the reason why. With tennis, there is a ton of side-to-side movement, right? So as you're moving side to side and then there's a really quick stop, it's really possible for you to keep going because of that momentum. So let's imagine for a second we're running to the right to get to one of our forehands. Unless you're playing on clay over at Old Forest, you don't want to do a lot of sliding. So as you come to that quick stop, your whole body weight is still moving to the right, but you're trying to balance everything on these little ankles right down here, right? So it's really possible that we do something called an inversion ankle sprain. It is the most common type of an ankle sprain. That is what happens when the ankle itself rolls in, right? We've done that a million times. So your body's going this way, you come to a hard stop, so you keep going that way, but your ankle is locked into the ground. You roll in, that's called an inversion ankle sprain, and as a result, everything from the muscles into the tendons and ligaments, they get stretched and yanked really hard, really fast. That's what a sprain strain is, okay? So you got your peroneals and your anterior tib muscles right through here coming down into these tiny little wires that make up the tendons and the ligaments that come down along the top of the ankle. So as you roll that ankle, these muscles and really the tendons and ligaments right through here, they get stretched really hard and really fast. And what happens is you get some micro tearing. It's not like a huge tear where the whole thing just rips entirely. You basically get little tears through the whole thing. That causes a lot of swelling, and with that swelling, a lot of inflammation as well. And that's where all of your pain comes from, okay? So your first instinct is gonna be to kind of give that a rest. That's a good first instinct, meaning that when I say rest, I mean probably a good idea maybe to head off the court and go sit down for a minute. I don't mean that your treatment plan is go home and sit on the couch for the next couple of weeks nursing your injury, right? That will develop its own kind of problems. We have to make sure that as that heals, it heals correctly, okay? So when you come in the office, we're gonna be working on things like shockwave and laser to make sure that we help the damaged tissue calm down, clear out the damage so that we can rebuild some healthy tissue. We want to make sure that we load that tissue. Fancy way of saying we give you very specific exercises that respond really well after shockwave therapy. That's going to help that tissue heal stronger, right? And work on some ankle mobility so that you're a lot less likely to have this happen again in the future, right? Because the stronger your ankles, the more resistant you're going to be to that inversion ankle sprain to begin with, right? So if it happens, we have a good plan of attack to help with the pain and help with the damage, and then hopefully prevent this problem from happening again, okay? That's probably one of, other than shoulders and elbows, this is probably one of the most common injuries we see with our tennis players. Thanks, guys.